Hi, my name's Tony Ward, and I'm an Associate Professor of Counselling Psychology here at the University of the West of England. And I'm sorry I can't be with you today. I had hoped to give this lecture in person, but unfortunately I can't be with you. And fortunately Gary has agreed to facilitate the lecture through some pieces that I've recorded. So this lecture is about a critique of mental health perspectives. Just to give you some thoughts about ways in which we can be critical about the sort of mainstream narrative in mental health. I've broken this up into 4 different parts, and the idea is you watch a part and then have a few minutes in between to discuss a question, and then play the next part and then do some more discussion. So hopefully it's not you sitting listening to me for ages, but you get a chance to do some interaction as well. So I'm going to use to start with the example of depression in making some critical points about mental health. Depression is a very widespread condition. Unfortunately, there's a lot of people in our modern society that feel depressed, and it obviously therefore is something that is very widely treated by our National Health Service. So just to get us started, it might be nice if you could just think for a moment on what is depression, how would you define depression, and what makes depression a clinical issue. And what I mean by that is that many of us might feel low from time to time. We might even label ourselves as depressed, but whether we would see it as something we need to go and talk to our doctors about is another matter. At what point does low mood become a clinical issue? So just have a think about that for a minute and maybe see if you can write a couple of notes. So, to think about this a bit more, I thought it might be interesting to look at a psychometric measure that's out there. This is a thing called the Oxford Happiness Questionnaire. It's a published scale. You can find it on the internet if you wanted to use it for some research or a dissertation. And in this scale, you read a number of statements, and you have to simply decide whether you agree or disagree with the statements. Now, for our purposes today, I just want us to have a quick look at this just out of interest. And so I'm going to go through the statements, and I just want you to think, for each statement, is that a statement that you agree with or disagree with? If you agree with it and say, yes, that does apply to me, then give yourself 1 point for each statement that you agree with, except for those items which have a minus at the end. And for those items you subtract a point. Okay, so we can quickly work out how many statements you think might apply to you and subtract the negative statements from that total, just to give us a very simple quick measure. Okay, not using the full range of scores at the top. So do you agree with this? So first of all, I don't feel particularly pleased with the way I am. Okay, if you think that's true of you, then you've got -1. Second statement, I'm intensely interested in other people. If you think that's true, then you gain 1 point. I feel that life is very rewarding. Okay, fourth question. I have very warm feelings towards almost everyone. Fifth statement, which is a negative, so you take one off for this. I rarely wake up feeling rested. Sixth statement. I'm not particularly optimistic about the future. That's a negative statement, so you take one away if you think you agree with that. Seventh statement. I find most things amusing. Number 8. I'm always committed and involved. Number 9. Life is good. Number 10. I do not think that the world is a good place, which is a negative item. So you take one away for that. Item 11. I laugh a lot. Item number 12. I am well satisfied about everything in my life. Item 13. I don't think I look attractive, which is negative. So you take one off if you agree with that. Next one, number 14, is negative 2. There is a gap between what I would like to do and what I have done. Number 15, I'm very happy. Number 16, I find beauty in some things. Number 17, I always have a cheerful effect on others. Number 18, I can fit in everything I want to. Number 19, I feel that I'm not especially in control of my life, which is a negative item. Number 20, I feel able to take anything on. 21, I feel fully mentally alert. 22, I often experience joy and elation. 23, which is negative, I do not find it easy to make decisions. 24, another negative item, I do not have a particular sense of meaning and purpose in my life. Question, that was a negative item, 24. 25, I feel I have a great deal of energy. 26, I usually have a good influence on events. 27, I do not have fun with other people, which is negative. 28, I don't feel particularly healthy, again negative. 29, I do not have particularly happy memories of the past. Okay, so if you were adding that up as you went along, you should have a total for all of the positive items that you agree with, subtracted, taken away from that the number of negative items that you agree with. So just quickly looking at it, there are 1, 2, 3, 4, 5, 6 negative items on that page, 7, 8, 9, 10 items with that page, 11, 12 on that page. So 29 positives, 12 negatives. So you could end up, if you accept all the positives and don't agree with any negatives, with a score of about 17. So that will give you an idea of how happy you are on the Oxford Happiness Scale. Now the reason for doing that, it's a bit of fun obviously, the happiness scale, but just to make the point that we can talk about depression and how unhappy people feel, but we can turn that around and look at the opposite side of the coin and talk about how happy people are. Most depression scales, of course, tend to go the other way around. They're coming at it from how depressed people happen to be. So this scale here is the Zung Depression Scale. Like the Oxford Happiness Scale, actually, there are negative and positive worded items. So some of the items you reverse score, just like you do with the Oxford Happiness Scale. So the first question obviously is clearly one about low mood. I feel downhearted and blue. And if you said that's how you feel most of the time, then clearly you're going to get a high score. You probably get a score of 4 for that. Second item, morning is when I feel the best, so that's a more positively worded item. And you'd probably get less points for agreeing with that for most of the time. So on this scale, a high score would give you a negative, would be negative and would indicate that you're depressed. So the point we're making really is that this notion of depression is just the opposite of the idea of happiness. If we think of a continuum, we can be happy, we can be sad. Depression is when we tend to be very much at the unhappy and depressed end of that scale. So this is not a hugely significant point, but just think for a moment then, in terms of the two scales we've looked at. We've looked at one scale that's been designed to measure happiness. We've looked at another scale designed to measure depression, the HAM-D. That's this depression scale is actually a clinical depression scale. It is used in clinical trials, as we shall see shortly. I would suggest that the items are actually very, very similar. I eat as much as I used to. I still enjoy sex. My mind is as clear as it used to be. So there's clearly some items on here that are reflecting the positive end of the scale, of not being depressed, of being happy. And then there's very negative items. I feel downhearted and blue. I'm more irritable than usual. And we could probably, if you did a comparison across to the Oxford Happiness Scale, you could probably find almost exactly the same items in each scale. So it's just a matter of which way around the scale is constructed, whether it's set out to try and measure a low score as being depressed and a high score as being happy, or vice versa. So at the end of the day, all these things are just scales designed to tell us from a questionnaire how happy somebody is feeling. When we started out today, we were thinking about what is depression and what makes people depressed. And it's interesting to reflect on what you thought at that point. What is depression? You may have said, well, it's scoring very high on a depression scale, like the Zung depression scale. You may have said that it's to do with having a clinical condition, a medically recognised condition. How would we go about identifying that would be the question. So some points I'm trying to make really at the outset here is, in actual fact, there is no simple clinical measure that can be used to detect depression. If you go to your doctors and say, I'm feeling really, really unhappy, I think I might be depressed, what can you do for me? There's no simple blood test, there's no biological marker that people can look for. Therefore, whether you are seen to be depressed often will come down to filling in these symptom type questionnaires about how you happen to currently be feeling. Your doctor may well give you a questionnaire just like this. There's one called the PHQ-9, which is widely used at the moment. So it depends, being seen as depressed tends to depend on coming out as unhappy and demoralised on rating scales such as these that we have been looking at. This is the Zung depression scale, actually, not the Hamilton. It depends on getting a high score on that kind of measure. But it doesn't tend to only be around that. If you go to see your doctor, he won't just go off the fact that you score high on some questionnaire. He will also tend to look at criterion of how it's affecting you. So is this low mood stopping you from doing the things in your day-to-day life that you want to do? Is it stopping you going to university, stopping you going to work? Is it posing a risk? Are you so unhappy that you feel that you've had enough, that you're feeling suicidal? And that tends to be a very important criteria too. What it's not based on, though, as I said, is any kind of simple medical test that you can be given. Now, having said that, of course, there is a biological view of depression. The biological view tends to be that depressed people have some kind of deficiency, problematic process with their serotonin system, the chemical symbol for which is 5-HT. Dopamine and norepinephrine are also sometimes included in that hypothesis, and hence common treatments for depression in terms of medicines are monoamine oxidase inhibitors, MAOIs, and SSRIs are now most widely used, the selective serotonin reuptake inhibitors. And there's some suggestions in the literature that there may be genes that code in our genetics for serotonin transportation, and that therefore leads to a genome versus environment interaction. If you've got that genetic predisposition to maybe have a weaker serotonin system, and that then interacts with a negative environment, and that creates depression. So there is this kind of biological hypothesis around a genome versus environment interaction. But all of this is very much hypothetical, because that view, the serotonin hypothesis, comes from the fact that the drugs that are used to treat depression that have been found to be helpful, sertraline, for example, is a current very common antidepressant that is a selective serotonin reuptake inhibitor. Because that drug works for depression, that's where we end up with the serotonin hypothesis. So it's not because serotonin has been seen to be independently low in people with depression, it's because the drugs are known to change the serotonin, to act upon the serotonergic system. And hence the assumption is that the lack of serotonin or impaired neuronal transmission must be implicated in depression. But we can't measure that. I have no way of measuring how efficient your serotonin system is at this point in time. We can't measure this in vivo, and so questionnaires tend to be used as outcome measures in clinical trials. Okay, we're going to pause here. As I said earlier, there's going to be a number of pauses for you to think and reflect. And so this pause is going to be around these questions, this question rather. So the question then, having gone through what we've just talked about, does it matter if there are no biological markers for mental health conditions such as depression? Does that matter? Okay, I'm going to give you, or Gary's going to give you a few minutes to break out and discuss that amongst yourselves, and then we'll come back after and see what you've made of it. Okay, so that's the end of part 1.